In this video, we will talk about third and fourth cardiac abnormalities of first group that leads to left-to-right shunt, which are the ventricular septal defect and patent ductus arteriosus. That will be explained later in detail. Now, we will discuss ventricular septal defect first. Moving forward, here is floor of the ventricular chamber. Then there is endocardial cushions. From the end of the fourth week, a muscular interventricular septum arises from the floor of the ventricular chamber. The septum rises towards the endocardial cushions, leaving an interventricular foramen. The ventricles arise as a single cavity that is divided by the developing interventricular septum. Before the septum closes completely, the remaining opening between the two ventricles is termed the interventricular foramen. As the atrioventricular septum is completed late in the seventh week, the endocardial cushion extends inferiorly as the membranous interventricular septum. To complete the interventricular septum and close the interventricular foramen. Now, class, have you noticed that from floor, interventricular septum arises as muscular part, but endocardial cushion extends inferiorly as the membranous interventricular septum. Now, let's discuss the ventricular septal defect. A ventricular septal defect is the most common heart defect, and when this muscular part and the membranous parts fail to fuse, it allows blood to pass from the left to right ventricles. That's why it leads to left-to-right shunt. This is called as ventricular septal defect, and we know that it belongs to group 1 of cardiac abnormalities. Now, moving to last cardiac abnormality of first group, and that is the patent ductus arteriosus.
Sir, I can recall that. What is ductus arteriosus? Well, the ductus arteriosus is a fetal blood vessel that connects the pulmonary artery to the descending aorta.
Yes, class. Now, in patent ductus arteriosus, ductus arteriosus do not close. So, let's understand the flow of the blood. Blood from right atrium enters to right ventricle, and then from right ventricle to pulmonary trunk, and from pulmonary trunk to aorta. As we know that aorta has high blood pressure, so from aorta, blood shunts into the pulmonary trunk, and from pulmonary trunk to the lungs. Now, let's discuss the symptoms of this disease. Tachypnea. Tachypnea refers to rapid breathing or an abnormally rapid respiratory rate. Tachycardia. Tachycardia refers to a rapid heart rate, specifically an elevated heart rate above the normal range for a person's age and condition. The normal resting heart rate for adults is typically between 60 and 100 beats per minute. And cyanosis. Cyanosis is a clinical sign characterized by a bluish discoloration of the skin, mucous membranes, and sometimes the nail beds, and a widened pulse pressure and other symptoms. But if we talk about the treatment can be surgical or pharmacological. So, this was all. In our next video, we will talk about the second group of cardiac abnormalities that cause right-to-left shunt, and it includes the Tetralogy of Fallot and Transposition of great arteries.
Discover a wealth of accurate, up-to-date medical videos for in-depth learning, anytime, anywhere. Elevate your medical expertise with sqadia.com.